We are at Dr. Karishma Aesthetics, and today I'm going to clarify all you need to know about gynecomastia. Post a gynecomastia surgery, you will go home the same day after the procedure. You can get back to your daily home routine by day 2 and day 3. If you go to office, you can get back to your office routine by day 5 to day 6. You do experience a little pain and discomfort for the first 4 to 5 days, so I'd leave it to the patient to decide how comfortable they are feeling. I suggest you should perform all your daily activities from the next day onwards. You will be wearing a compression garment from day 2 of the procedure, and that has to be worn for about 2 months after the surgery. You can go to your office by day 6 to day 7. Most of the people resume their work activities by day 6 to day 7. Coming to the exercise routine, I advise that in the first 2 weeks you can just go for your casual walks. After second week, you can start light jogging and a light exercise routine from week 2. From week 3 to week 4, you can get down to high intensity workouts. You could see if you are experiencing a little pricking sensation or a little pain at the nipple area. It would tend to happen because the nipple is a very sensitive area and a lot of nerves have been disturbed while doing the procedure. So I suggest first 2 weeks, keep it just to walks. After second week, start on a light exercise routine. After week 3 to 4, you can start on your weight training, chest exercises, and your high intensity sport activities after week 4. You will be wearing your compression garment. When you go for your exercises and to the gym, you can take off the garment when you go. You can shower daily after a gynecomastia surgery, even on day 2. A normal daily shower is advised, washing your wounds, putting an antibiotic ointment at the site of the small keyhole incisions, and wearing your garment. We advise you to start manual lymphatic massages, also called as the MLD. You will be starting this on day 6 to 7 because this is when the swelling starts to happen, and the manual massages are extremely important to allow the swelling to settle and also not to leave behind any residual skin lumps. At times post gynecomastia, a few men experience a little fluid collection under the nipple, which can tend to cause a hardness later after a few months. So these massages are really crucial to not allow any fluid accumulation there. It will allow the lymphatics to drain out, the skin lumps to settle, the hardness in the skin to settle down. The skin has to soften up, and it takes about 2 to 3 months. So massages are very crucial in the 2 months. Wearing your compression garment is the next most important thing. And of course, you can get to your routine and your exercises really quickly. The usual scars after a gynecomastia surgery are extremely small. The incisions that we make on your skin are usually within the natural skin creases that exist over there. If we are doing a liposuction, then there will be a small keyhole incision inside the armpit, which is absolutely not visible at all. Those little tiny incisions close in about 4 to 5 days, and you will see a little scab which peels off. And I think after a few months it's hardly visible. We provide you with the scar creams. In case we have done a gland removal through a cut which is made underneath the areola, it's just a 1 to 2 centimeter cut. It is made at the dark border, lower border of the areola, and it is highly invisible after a few months. Well, I think most men would be quite happy by removing a large gland in replacement for very tiny, almost not noticeable scars. Is it possible that your man boobs or your gland starts enlarging later in life after you have done the surgery? Is a recurrence possible? In a very rare circumstance, it could be possible. If you have had excessive weight gain over a period of many years, there have been certain spurts of hormonal imbalances or drastic hormonal changes in the body, or steroid use. In any of these conditions, it can happen rarely that the gland starts to enlarge again, but in more than 95% of the cases, we usually do not see a recurrence. If there is a small recurrence, please visit your plastic surgeon. There's nothing to worry about. It can be treated with a minor revision procedure.